is
not too bad.
We're live. We are now live. So, hello. We're going to go live here in about 5 minutes. This is Mike Lipscomb, and let me turn the camera around. Mike Lipscomb and my colleague here, Dr. Ed Malcom, will again be coming to everyone live in about 5 minutes and just talk about coronavirus, kind of what we know, where we're at, give everyone a little insight from just folks on the front line about our thoughts about COVID. And just as a quick disclaimer, this is really our thoughts. We're not representing any organization, hospital system, or whatnot. We're just kind of putting things together for all of our folks who are watching. I was asked to do this by a local cycling club. And it's kind of grown a little bit, but again, my comments are really directed at the cycling club, but anyone is welcome to watch and join. So we're going to go silent here for a few moments here. Now, Dr. Malcolm's pointing out we are coming to you from like North Atlanta, so this will have a little bit of an angle from North Georgia, but we'll have application across the United States. So you're going to get a little biology lesson here. You're going to get some facts, a lot of things that maybe you've seen before, but kind of put together in a way that may be helpful to everybody. I will point out a couple sources that I think are very good sources to go to. There's a lot written out there on social media that's kind of baloney and a little bit questionable, but give everyone some good sources to go to just to get information as this changes on almost a daily basis. So I guess I'll sit here and look silly for a few minutes while we're trying to start. We just want to let people get on. We do want to start around 7 o'clock. There is about a 30 to 40 second lag here. So there's about a 30 or 40 second lag here. So I won't be able to start exactly on time. I'm getting a lot of friend requests right now. I know how to get friend requests, I guess. Just go on live. But it sounds like everyone's connected, and let me know if anyone has any problems. You can message me at the bottom. Nobody can see your messages, I've learned. So you can send me some private hate mail or whatnot without other people seeing it. What else? I'm sure I'm going to get a lot of comments from doctors saying, hey, this is not quite right, or hey, you didn't say this quite right. I have one friend that says I'm about 60% accurate when I'm at trivia. You know who you are. I do much better in the emergency department, though. Yeah, trivia is not really geared toward doctors, I don't think. All right. Well, I don't have any... Oh, I'm getting words of encouragement. This is great. Y'all can hear me pretty good. Good. All right. Well, if anyone has any problems, just feel free to just text and say, hey, I'm having some trouble or whatever. The volume needs to be turned up or whatever, and we can work on. Oh, my goodness.
Before you get on.
Okay. Well, we're already on, Sue. So you are, sorry. The whole country's looking at you.
Sorry. Come on. It's not 7 yet. Come on.
Very good. Okay, wait, I gotta, go ahead, Ed, say something. I gotta get my dog out of here. Nova, come on.
Okay, we'll be starting in about a minute.
Okay. Nova doesn't understand Facebook. Okay. Live video interrupted. Oh, we need to refresh this.
So yeah, it's...
Hang on. Well, it's 7 o'clock. All right, so it's 7 o'clock, so we're going to get started here. Again, this is Dr. Michael Lipscomb. This is my buddy and close colleague, Dr. Ed Malcom. He is medical director of our local emergency department. I was asked to do this video by a local cycling club, and this is really directed at them, although anyone is welcome to listen. That's kind of a disclaimer. Just to let you know, the medical community is discussing this issue of COVID on an almost daily basis. All of our emails basically are about COVID. I've probably spent about 10 hours today on emails, phone calls, chat rooms, and so on, just talking about COVID and COVID preparedness. So we have a little bit of kind of angle on this, and we'd like to share with you kind of what we know up until this point. The presentation is going to be about 45 minutes. Sorry about the PowerPoint, but I don't like the bullets and all that. I try to use pictures and diagrams and so on because I think it explains things much better. And again, just a disclaimer, we're not representing a hospital, any medical group or anything. We are basically just putting together what we know as emergency doctors on the front line. So I'm going to turn this around and we're going to kind of shoot through some slides, and hopefully we learn something about COVID, kind of where we're at. And you all learn something and enjoy it. So here we go. COVID-19, let's work together and stay apart. I kind of struggled a little bit with that title, but at the end of the day, the message that you're going to get is right now we just need to stay apart, and we need to all work together to that goal. This is okay, technical problems already. Okay, here we go. So this is a great meme. I've kind of learned what a meme is in the last month. Kind of the Corona bottle in the corner. Many of y'all may have seen this. And there's all these frightened bottles in the other corner of the refrigerator with this N95 mask, thinking that this mask is going to save them, this life-threatening mask. And they just kind of all look terrified, and just kind of, I like this slide because it just kind of seems to be kind of the confusion and kind of scaredness that we all have around the coronavirus. So let's learn something about it. What I'm going to do is I'm going to go through a couple things. What is it? Where are we today? And what can we do as individuals about preventing spread of this terrible virus? So what is it? Let's just kind of start basic. What is a virus? These are a bunch of viruses. Up here is the fox virus, vaccinia virus, the mumps virus. Viruses, just so you know, all attack a very specific part of the body. For example, herpes virus attacks the nervous system and then shows up on the skin. Down here we have the polio virus. As we know, it also attacks the nervous system. In the middle, though, here we have the influenza virus and the coronavirus. They actually look very similar. They both attack the respiratory system. This is a respiratory virus. Interestingly, down here we have the tobacco mosaic virus, which is interestingly shaped like a cigarette, which was the first virus ever discovered. And why was it discovered? It was discovered because in the 1880s, a bunch of tobacco plants were dying, and they figured it was some kind of a living entity that was attacking these plants. And so there was a lot of focus placed on this, and they discovered the tobacco mosaic virus. So the point is, when something is important to a community, focus is paid attention to it. We've had coronaviruses around for thousands of years, and we are only now paying attention to it in the last 20 years because we've had now a couple cases of very severe illness related to coronavirus. What is COVID, coronavirus? What are these words? COVID-19, we've heard this word, coronavirus disease 2019. This is the disease. This is the disease. The other word we hear about is SARS, coronavirus 2. This is severe acute respiratory syndrome, coronavirus 2. So this is the actual name for the virus. When did this virus first appear? It appeared in Wuhan, China in December 2019. This is the Rhinophilus bat. This is where we think it comes from. The reservoir for coronavirus, and the reason this virus will never go away, is that it lives in the bat population. And anybody knows anything about bats, there are many more bats in the world than there are people, and there are a number of bats in China. We think that this coronavirus or COVID-19 was transmitted from the bat through a mediator. We think the mediator may have been the pangolin. This is a mammal. It's a very rare mammal that is sold in China. It's sold in markets something like this. So here you can see there are actually some dead mammals that are hanging, these meat slabs here. And it is also possible that these animals were the mediator, that bats, not by biting these animals, but bats by their excrement on whatever fruits or grass or whatnot that these animals ate may have contracted this virus and then transmitted to people. So what we do know, though, is when you get bats in close proximity to some mediator animal and humans, and you have all of these people in close proximity, that this is a potential for a coronavirus epidemic. We know this happened for the first time with the SARS-1 virus, and it also came, again, from bats through another animal, probably through an animal called a COVID, to people through a meat market, something like this. What is the coronavirus and where does it get its name? The virus is very, very simple. All viruses are simple structures. They are a bunch of proteins. In this case, there's these spike proteins on the outside. There's an envelope of proteins, and then on the middle is RNA. RNA is very similar to our DNA, and it is the library, if you will, for how all proteins are created. So this is a very, very simple structure. Interestingly, these things cannot reproduce on their own. There's no energy generating thing here. These things are very dependent upon hosts such as bats, such as mammals, such as humans to reproduce. And they become very efficient at doing this. To the right, this is what coronavirus looks at under an electron microscope. The corona, it gets its name from the crown or halo type appearance of these dots around the virus. This S spike is, again, the S protein. This was first discovered in the 1960s in chickens that were infecting humans through one of the early kind of more minor coronaviruses. They have probably been around, though, for thousands and thousands of years, again, first discovered in the 1960s. This is the MERS virus, and I'm not going to go into this very complicated slide, but the MERS virus was a Middle Eastern respiratory syndrome that existed or first was noticed in 2012 in the Middle East. And kind of like what happened in China, bats came into contact with camels in some way, and camels are the mediary that gave this infection to humans. It had a very, very high death rate, somewhere in the 20 to 30%. So these, again, coronaviruses are respiratory viruses. Somehow the camel emanated these virus that got into people's respiratory system and down into their lung. And this is what a lung x-ray might look like of someone who has this virus. You can see there's a bunch of white on either side, which should not be there. This should all be dark here and dark over here. And here's a CT scan. And all this stuff that's kind of whitish over here, this should all be very dark. So basically their lungs are filling up with fluid. This is an alveoli. This is way blown up from that picture I just showed you. This is the air sacs. When we breathe air, they come down into our air sacs. And these are little virus particles. That's a MERS virus, very similar. It is a coronavirus, very similar to COVID. Here they are. They're infecting cells on the lining of the alveoli. And this alveoli is now inflamed and filling up with fluid. So all this air, we're supposed to be able to use this whole air sac to exchange air, can't do it. Here's a blood cell that's running by this alveoli that's trying to get oxygen, and it can't do it because all this fluid is there. That's what's going on when somebody is getting very, very sick with COVID virus. How does it reproduce? Again, I told you it came down into the lung. Here is a lung cell here, representative lung cell. Here's the virus over here. It attaches to very specific receptors, the ACE2 receptors. These are type 2 alveolar cells. Comes in. The RNA, remember that stuff, all this pink stuff in here, unwinds, and it tricks the cell into start reproducing virus. Instead of making its own cell, the type 2 pneumocytes, instead of doing that, all the cell is doing is making virus, and all these virus particles are released on the other side. This, again, is under electron microscope. Again, this is what a coronavirus looks like. And here you go. Here's the inside. This is a cell in the lung. This is a bunch of virus. It's been replicated. It's going to come up to the surface and it's going to burst. And all these viruses is going to cause a bunch of inflammation and fluid within the lung cells. Real quick, virus versus bacteria. There's a lot of confusion. Why don't we have drugs against this virus? Why can't I just take a pill? Well, this up here, this is a blow up of a red blood cell. This is a human cell right here. Just for size, this is a bacteria, kind of sausage-shaped thing here, and these little specks down here are viruses. So this is all kind of relative size. Now, if you blow up this bacteria, this is the bacteria, and here's viruses down here. And if you blow it up again, here's that bacteria and a bunch of viruses. Again, just kind of give you scale. Interestingly, this is a bacteriophage, so you actually have viruses, that's this, that can actually attack and reproduce within bacteria. So people always ask, well, again, why can't viruses be attacked with drugs? Now, some can. I'm going to get to that in a second. But generally speaking, viruses have virtually no metabolic capabilities. They are very simple structures. And because they are so simple, it becomes paradoxically hard to fight them because there's very limiting points of how to harm them. You know, humans, there's lots of ways to harm a human, right? We can get in, have a stroke, we can have a heart attack, we can get kidney disease, we can get in a bike accident from all the crazy people in Atlanta. It can be any of these things. There's lots of ways to end a human. There are less ways to end it for a bacteria because they're simpler structures. And then when you get down to these viruses, there's only a couple things that you can do, and the things we have don't work very well. So again, why not antibiotics? This is the difference between bacteria here, viruses here. Bacteria can be easily killed using antibiotics. I'll question that. Not all bacteria can be easily killed, but this is the best I could do in getting a graphic. But anyway, bacteria, because of multiple kind of points that you can hit them with, a lot of ways they can be killed. Minimal for viruses. And just kind of the proof is in the pudding. There's tons of viruses out there. We do have some medication against the HIV virus, although we can't completely get rid of it. There's medicine against hepatitis C virus. We've been more successful with that one. Of course, influenza virus has Tamiflu. These medicines do not work very well at all. COVID-19, we have some possible treatments out there that are in testing, and go to a bunch of websites that will tell you how wonderful these drugs are, but in practice, they are not definitely not proven. So what are the symptoms of coronavirus? I think we all know what these are, but generally it starts with mild to moderate upper respiratory tract illness, fever, cough, shortness of breath, but similar to many other viruses, including influenza. How does it differ from influenza? Well, the incubation period, about 5 days, 2 to 14. Influenza is shorter than this. So you can have this and be walking around with it for about 5 days before this dotted line right here is when symptoms start. We think people are contagious when their symptoms start, but they may actually be contagious a day or two before symptoms start. So this slide may have it a little bit wrong. It starts with fever, a little sore throat. You might be sneezing, might have a cough. But there are reports of people who are completely asymptomatic with this illness as well. Clinical deterioration starts at days 7 through 10. So you start feeling terrible out here. So you're walking around with a little bit of upper respiratory whatever. You think maybe allergies, but you may very well have COVID in here. Problems start out here. So again, different from flu in that it starts with mild to moderate symptoms, whereas flu, boy, it nails people within about 24, 48 hours and they feel terrible. So flu, this is worse than flu because flu, when people get it, it puts them in bed very quickly. They're out of commission. This one, people can walk around with it and spread this virus. The myalgia is kind of that muscle aches that people get with flu, much less common in coronavirus. Also have a little bit less runny nose, which we thought was kind of an early distinguishing characteristic, that you just didn't have much runny nose with this one. Treatment and testing, there's no vaccine for coronavirus. This is going to be one of the things I think that's going to save us in the future is developing a vaccine. No specific antiviral treatment. And the testing right now, as we all know, we want to get a test, very limited. Difference between influenza, this is flu over here. These are death rates from the illness. Influenza here, COVID here. And you can see in people that are elderly, greater than 65, this is 65 plus, it's less than 1%. But if you break it out here by age with COVID, 3.6%, 8%, 14.8% if you're over 80 years old. This has a very high death rate for older folks. Okay, what have we learned? We all remember the Diamond Princess cruise. At one time, this was the largest number of cases outside the country. So this Diamond Princess cruise sailed from Hong Kong in January 20th of 2020. This was only 2 months ago we were hearing about this. In fact, we didn't even hear about it till the end of the trip, which was even 2 weeks later. So this Diamond Princess cruise took off January 20th with 3,700 passengers for Hong Kong. It left from up here from Japan, went down to Hong Kong, went down to Vietnam, back to Taiwan, and then back to Japan. So what happened? What's the timeline? On January 25th, there was an 80-year-old patient that disembarked from the cruise in Hong Kong. So 5 days into the trip, this guy gets off. 7 days later, he's diagnosed in a Hong Kong hospital with COVID-19. So this is radioed back to the ship as people on the ship are now starting to get sick. And on February 3rd, as they went back into Japanese waters, the 3,700 passengers and crew were quarantined on board this ship. And they were there to be quarantined for the next 2 to 3 weeks. Now, the good news is we've learned a lot because every person on that ship was tested and some were tested multiple times. What we learned was 712 or 19.2% of the passengers tested positive for coronavirus. Of the people that tested, 46% had no symptoms at the time they were tested, and 18% went on to exhibit no symptoms. So of that 46%, a good, about third or 30% went on to have no symptoms at all. So what we think is that of people who are out there with coronavirus, maybe as many as 18% will have no symptoms. What we don't know is their transmissibility. So people that have absolutely no symptoms, at what rate are they transmitting the disease? Probably less than the people that are very symptomatic and coughing and sneezing and all of that, but they're still out there and likely transmitting disease. There were 11 total deaths out of the 712, which is a 1.5% death rate. And that's of March 22nd. I don't know if anyone else has passed away since that time. We do know that the infectivity rate per patient before the quarantine, there was a quarantine that happened on February 4th where all the people were sent to their quarters and not allowed out of their rooms. One person would infect about 7 other people, a very high infectivity rate. But realize they were in close quarters, so it may not be this high across the United States. After the quarantine, one person would infect less than one other person. So what's the teaching point? Is there were a lot of criticisms of the quarantine, and I'm not going to get into that here, but we do know that isolating people from each other made a big difference. One of the big lessons we learned from this cruise. The other thing is we learned was what I already mentioned, the high occurrence of carriers who are asymptomatic or minimal symptoms. Okay, so where are we today? This is back data from March 3rd. This is how fast this thing has happened. Worldwide infections about 90,000. U.S. infections 124 on March 3rd. Today, or 25 days later, this is a couple days ago, worldwide up 7 times. United States up 1,000 times. Congratulations, United States. We are number one once again in something else. We are the highest number of new infections in the world. This is another way of looking at it. On March 10th, this is the cases worldwide. March 28th, this is the number of cases worldwide. And you can see that all of these arrows that are going up, these are all pretty much Western countries, United States, Italy, Spain, Germany, France. Iran is one of them, did very poor with their containment measures. China's kind of leveled off. South Korea did very well. So one thing I would like to bring up, what about Singapore and Hong Kong? I know no one probably going to ask that question. But Singapore and Hong Kong did something very unique in their medical system that very much helped them that I'm going to talk about in a little bit. Very successful. We're going to discuss those points later. So current state, this is an excellent source of truth. This is a very good website. This is, if you Google search Johns Hopkins coronavirus, this is a world tracking map. This is the tracking map, as you can see down in the left corner from March 10th. This is how many cases we had. And this is just 18 days later. Number of cases worldwide has increased 6 times. Number of deaths has increased about 7 times. And in this time period, United States, you can see US right here, we are now number 1. We were way down here before, and we have rocketed to the lead. This is the United States again, and this is actually as of this morning, 143,000 cases, 2,500 deaths. Now this death number is probably accurate. This total cases number is probably grossly underestimated, again, just related to our inability to test right now. So this is the line. This is number of new cases. And you can see we're just going up, 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 up right now. Right now is not the time to be out and about. We need to be at home. This is a projection of number of deaths. This is actually another excellent source. This is the Institute for Health Metrics and Education from 2 days ago. This is a not-for-profit that is funded primarily by Melinda and Bill Gates. I would consider this a very reputable source of information. We are right here on the curve. We have about 2,000 to 3,000 deaths right now. Their projection is coming up to about 80,000 deaths in the United States. And this is with current quarantine measures and so on in place. Now, there's obviously a spread to this. This is obviously a guess, but we think on the low side it may be 40,000. On the high side it may be 160,000 deaths. This is not gonna be good in the next month or so. We're gonna have a very clear picture about 30 days from now. What can you do? Okay, so let me back up and say any virus. We're gonna go back and talk about any virus. Before you have it, you can get immunized from it, or you can stay away from it. That is the only way that I know of not to get it. Now, after you have it, some viruses have antivirals that, again, I'd said don't work very well. But if there's no antiviral, immune system in rest, that's basically staying at home, keeping your fever down, taking Tylenol, and drinking lots of fluids. And you may need supportive care, and I'm going to talk to that in a little bit. When do you need supportive care? When do you need to go to the hospital? Okay, let's talk about coronavirus. There's no immunization, and there's no antivirals that work right now. So we are down to let's stay away from it. After you have it, again, rest, and again, you may need to go to the doctor. Ways that it can be spread, we know this, is primarily spread from droplets, from cough or sneeze. There is some question marks. Question marks right now is to maybe there's a little bit of aerosolization in certain specific circumstances, but you got to be thinking cough, sneeze, droplets. When people are coughing, sneezing, wiping their hands on stuff, that's where this virus lives. When you go to the grocery store to get your food today, you need to be thinking that everything you touch may have this virus sitting on top of it. You need to be washing your hands. You need to be cleaning the food you get as soon as you get home. It's also from contact with surfaces containing viruses. Any touch, handshake, or even close contact with people within 6 feet can transmit this virus. So, prevention. Don't let it contact you. What are the measures we have? Number one, on a regular basis, did she draw? I just had a little glitch right there, sorry. On a regular basis, and it's very important for her to share these with her grandmother and grandfather. So let's get rid of that word, or I don't like that word social distancing. I like the word physical distancing. So it's just something to keep in mind because it tells us what we need to be doing. We don't need to be socially apart from people. We need to be talking to our family. We need to be talking to our friends. We need to be supporting them right now, but we need to be doing it at a physical distance. Okay, why does physical distancing work? This is from the Washington Post. This is an excellent visual. A couple people are infected, and if we're not doing anything and we're just kind of going around our own business, you can see exactly how fast the world gets infected. It happens very, very quickly. And here's a graph over time of how fast people can get sick. Let's go to another example of social distancing. Now we're keeping people at home. Only a few people are bouncing here and there. And you can see how much slowly this thing spreads. The number of people who have this illness at any one time never gets too high. We're never going to overwhelm our medical system if this is what we're doing. Okay, physical distancing, a tale of two cities. This is from a lesson we learned from the Spanish flu of 1918. There were two cities. One is Philadelphia and one is St. Louis. In Philadelphia in 1918, what were we doing? This was the middle of World War I. They had a parade to support the soldiers. Now, we knew the flu was out there and we knew it was a bad flu, but they went ahead and had the parade anyway. There were 200,000 Philadelphians who were in very, very close proximity to each other. And what happened as a result of this, I'm going to get to in a second, but you can imagine that this isn't going to end well for Philadelphia. St. Louis, however, also had a parade scheduled that was canceled. Within 2 days of their first cases, they also went on to close schools, playgrounds, libraries, churches, and all public gatherings more than 10 people were banned. Does this sound familiar as to what's going on in Alpharetta and in very many cities around the United States? Let's see exactly what happened. This black line here is Philadelphia. The dotted line down here is St. Louis. This is the death rate on any particular day. Much, much worse in Philadelphia. The overall death rate, too, from St. Louis was only 50% that of Philadelphia. The number of deaths in St. Louis, it was a smaller town, but the number of deaths much, much less as well. So 1,000 versus 16,000. And the concern here is when you have this many people at one time, you are going to overwhelm the medical system, and the ability to care for people is going to go way, way down, which explains a large part of this death rate over here. And this is what we call flattening the curve. Many of y'all have heard that word, flattening the curve. Okay, tale of two cities. Let's talk about what's going on today. Now, these are two cities where it's not going to end well for either city. The first is New Orleans, and Mardi Gras couldn't have happened at a worse time. It happened in February 2020. It happens in February every year, and there's a number of people that get together and basically throw a large party in New Orleans. In fairness to New Orleans, there were only 15 cases that were reported in the United States at that time. So they decided not to call off this parade. And these are all pictures of what was going on. These are not old pictures. These are pictures from 2020. This is from last month in New Orleans, all these people getting together. What's going on in New Orleans today? New Orleans is by far the highest per capita death rate of any county in the United States. And right now they're working on measures to build extra hospital capacity. They have 1,800 positive tests and 65 deaths. As of this morning, this number is actually up to 73 deaths and counting. This is Mayor LaToya Cantrell of New Orleans. She said that they would have called off Mardi Gras if the red flags were raised. If they had only known, if we had had testing at the time, maybe they would have called off Mardi Gras. Here's the Governor Edwards of Louisiana. Ventilators can now become a major problem, because what's going to happen is the system, they believe that the system in New Orleans is going to get overwhelmed. Jefferson cases are 63% of all these growing cases in New Orleans. And right now, this is one of the large convention centers in New Orleans that they're going to convert into a medical facility because they know that their medical system is going to be overwhelmed. What's going on in New York? This is a daily basis of New York. We've all seen these pictures of what's going on in New York. This is New York, Madison Square Garden. Look at all these people. This place is packed. This is a To Kill a Mockingbird play put on by a high school. And this was February 26th of 2020. We kind of had an inkling that we shouldn't be doing this at this time. But plays like this continued for another week in New York. And you can imagine how the coronavirus is just spreading within all the people within this building. New York today, this is March 26th. This is Governor Andrew Cuomo. It's projected that the state will need at least 140,000 hospital beds. They are projecting the need for double what their current capacity is. They think the death rates are going to rise in about 3 weeks. So we're going to know the answer to this in about 3 weeks. We need 30,000 ventilators. These are the machines that put oxygen into people's lungs when they can't otherwise breathe for themselves. They are 30,000 ventilators short. That means if they don't get these ventilators, there's going to be 30,000 people who may not make it simply because we don't have the equipment due to how many people are going to have this illness. Fact check on this. This is a gentleman, Anthony Fauci, who is actually on the president's kind of group of folks who are on the coronavirus task force. He is I will tell you that he is a source of truth. He's a very good person. He's often disagreed with the president on certain things, but when this guy talks, he's going to tell you he's going to tell you an accurate story. Let's do a different type of fact check. Projection. New York City has 8.6 million residents. Let's say that 30% of them have COVID, which is a somewhat accurate, a conservative, not aggressive one way or the other number. That means that 2.58 million COVID patients will exist in New York City. A low number here, let's say only 5% of those patients are hospitalized. That's 130,000 hospital COVID patients. We think that 20 to 40% of these patients may need specialized care in the intensive care unit setting, the very highest level of care in a hospital. That means that we need 25 to 50,000 ICU beds. And of the people that go there, about 50 to 100% we think may ultimately need a ventilator. That's going to be 12 to 50,000 ventilators. What do we have in New York right now? We have 53,000 beds, 3,000 ICU beds, and 11,000 ventilators, which puts us about 70,000 beds short, 22 to 48,000 ICU beds short, and 1 to 9,000 ventilators short. Now let's change this scenario a little bit to 8% hospitalized, and just running the numbers down, we're a bunch of beds short, tons of ICU beds short, and 9 to 69,000 ventilators short. It's going to be a grim story of what happens in New York. What are they doing? They're trying to increase their hospital capacity by just basically telling all the hospitals there that you got to take 50 to 100% more patients. Basically, for every bed, you need to make another bed for a hospital. They think that that's going to increase their beds. It's 32,000. They're setting up makeshift hospitals at convention centers, and this is what it looks like inside the convention center. They brought the U.S. Comfort of 1,000 beds. These are not going to treat COVID patients, but the other patients, think of all the people that are still having heart attacks and strokes and all the other problems that we're still seeing within the medical system need to be cared for, and this ship is going to help. And they're looking for ventilators. They're about 30,000 short. And this is a picture of a ventilator. We've all seen them on TV. As you can imagine, these things aren't cheap. They're about $25,000 to $50,000 a piece. This is a patient on a ventilator over here. So again, remember, we got to stay under this curve. We got to stay away from each other, so we kind of flatten these measures out, flatten these cases out, so that our medical system can handle these cases that are coming through. So even if we flatten the curve now, what is the prediction in the United States? It's difficult to know. Different parts of the United States are getting hit at different times. But I'm just going to kind of throw these numbers out there just for your consideration. And there's an article from the New England Journal of Medicine that projects that is again a projection, if only 5% of the population gets this, which is probably a little bit low, and a 0.5% death rate, what is that going to look like? And these are kind of the numbers. But it looks like we're going to have almost 1 million patients in the ICU that are going to be COVID positive patients, and we're going to have about 80,000 deaths. Now, if we take these numbers and we kind of do what I did before, saying that, well, let's just take the hospitalized patients, and 50% of them wind up in the ICU, and then only 50% of them need ventilators. How did the numbers shake out for how our country is prepared for this? Well, these are the numbers here, and this is what we have. And you can see that we are woefully short on ICU beds. We are woefully short on ventilators right here. We're 500,000 ICU beds short and 120,000 ventilators short. Now let's change this and say, okay, let's just say 10% of the population gets infected. And you can see that we are way short. 1 million ICU beds short, 440,000 ventilators short. So what we want to do, we want to prevent New York and New Orleans. We want to close schools, and we want to close large gatherings. This is Disneyland over here, schools. They have been closed. This is going to make a big difference, our social distancing. So again, not social distancing, let's call it physical distancing. And I just can't overstate this enough. Of course, the obvious things, we want to avoid coughs and sneezes. We want to stay 6 feet away from each other. There's something about being within 6 feet that promotes either touching or maybe some of this aerosolization that we don't really understand very well. You want to avoid touching handles and common surfaces. Handshakes are obvious. What are the other things that a lot of people don't think about? My wife was at the store the other day, and she saw people just grabbing carts without wiping down the handles. The store that she went to, they actually stole all the wipes. Someone had broken into the store and stolen all the wipes the day before, and people were saying, I don't care. And they were just picking up the carts and pushing them along. Of course, door handles. This is one of my favorite ones here. This is the airport in Atlanta. And these are these poles that are life-saving poles. They're kind of safety devices, but it's kind of almost the opposite. They're kind of the opposite of life-saving devices in this case, because flu gets passed every year right here. And just think about animals. You know, your neighbor, his dog runs over, and your neighbor's been touching their dog and so on. Now this virus doesn't attack animals. That's not what I'm saying, but the virus can live on the skin and fur of other animals. So you just want to be careful, just even scratching someone's dog who you may meet on the street. Okay, so I mentioned Singapore and Hong Kong. Why were they so successful? They were very, very good at droplet isolation. Here's China, the biggest number of cases initially early on, over 80,000 cases. Hong Kong is right here. Singapore is down here. This is another source of truth. Atul Gawande. This is him in the New Yorker from March 21st, just over a week ago. He is a noted general and endocrine surgeon at the Brigham Hospital, Brigham Women's Hospital in the Northeast. He's also the CEO of the independent healthcare venture started by Amazon, Berkshire, and JP Morgan that was specifically geared toward better outcomes across those companies. So when he is another excellent source of information. So what did he say? He noted that in Singapore and Hong Kong, there were a number of measures that helped, and they didn't do the fancy stuff. It was just all medical people wearing surgical masks, because in these countries, medical workers were 3 times more likely to have disease than other people. So that surgical mask helping spread disease back to patients. Also, gloves and proper hand hygiene were emphasized, disinfecting all surfaces between patients, and then cohorting patients away from each other, separating patients by 6 feet, and treating sick patients in separate areas. And this is an example. This was a very infectious patient that they discovered 4 days after, and this is a hospital in Singapore, 4 days after after they were intubated, were diagnosed with COVID. And a number of people were around this person, but because they took high-risk precautions of hand washing, gloves, none of these healthcare workers developed COVID. And they didn't have all the fancy stuff, the N95 respirators, the goggles, the gowns, none of that. It was just proper hand washing and just being very cognizant of what everybody was touching. Now, all that said, is there some aerosolization? Just over the weekend, in the paper, Mount Vernon, Washington, choir practice. On March 10th, for about 2.5 hours, there was a church that decided to meet and have choir practice. There were 60 members that came. No one appeared ill. No one was allowed in if they were sneezing or coughing. They observed hand washing. They weren't allowed to hug each other or handshake, but they were singing in close proximity to each other. 3 weeks later, of these 60 people, 45 were COVID positive, and today 3 are hospitalized and 2 have died. Do they think it maybe was singing, the fact they were in close proximity? There is something about being close to each other, and the point is we should not be doing these kind of meetings anywhere just thinking that, oh, well, we can kind of get away with it here because everyone's fine. We're not going to handshake. We're not going to do this stuff. Realize what happened in Seattle. Take this as a lesson. The New England Journal of Medicine is also came out with an article a few weeks ago that when nebulized, because it's kind of a special machine, when you nebulize this virus, there are particles in the air for up to 3 hours. So again, this is a very specialized situation where it can be up to 3 hours, but where it can be up to 3 hours. So this is not your typical just sneezing into the air, but these particles can maybe just kind of stay buoyant in the air for a short period of time. Last, clean hands regularly. What do we want to be using? We want to be using hand-based, alcohol-based sanitizers that are greater than 60% alcohol, or we want to be hand washing with soap and water for at least 20 seconds. Does it have to be antibacterial soap or what? It doesn't matter. Soap is soap. Soap destroys the membranes of viruses, and you need to be doing it for at least 20 seconds. What about masks? This is a standard surgical mask. This is the N95 mask that you may have heard of. The difference between the two is the N95 mask does not let viral particles that are aerosolized through the mask. This mask over here, though, however, catches droplets. Now, I'm sitting next to Dr. Malcom right now, and if I want to protect myself against this illness, what do I want to do? Do I want to wear a mask myself, or do I want to put a mask on him? The answer is I want to put a mask on him. If I am wearing this mask and I'm walking around in a grocery store and people are coughing all around me, this is the better protection for me is for all of them to be wearing masks because it's stopping the droplets from leaving their proximity. So just something to think about. The idea that you're wearing this life-saving mask around is not helpful. What's helpful is staying away from people. This is kind of a funny little graphic that I saw the other day. All these guys, you can see the difference. They've all shaved their beards. All of us in the medical community have, those of us that, well, I don't, but people have had facial hair have all shaved it, and these are some medical folks who are not real happy with the coronavirus. Okay, so let's go to the doctor and be tested for this thing, right? We need to be tested. I need to know if I have it. Well, there is little utility in individual testing. Why is that? It's because the test is only about 60 to 70% accurate, which is similar to flu testing. So for any one individual, it doesn't really change treatment. if you are sick, you need to be staying at home. Even if you don't have COVID, you should still be staying at home, because if you have an illness that's not COVID and you give it to other people, then they may worry that they have COVID because they have a viral type syndrome. The other issue is we have limited testing kits, and this may change in the next week. This may change in the next couple days. We keep hearing that test kits are around the corner, and there's simply not a lot of test kits out there. Hospitals are reserving these kits for admitted patients only. They are not testing people in emergency departments. We don't have enough tests to test everyone through the emergency department. Testing centers even have limited kits. In Cobb County, they are only testing high priority patients. I actually wrote a prescription for someone to be tested over in Cobb County, and this was an EMS worker. This person had to wait in line behind other people that were more high priority. And of course, this may change. So the conclusion, do not go to the ED or to your doctor for testing alone. You absolutely want to go if you're having breathing trouble or your intuition tells you to go. In other words, if you otherwise would need to go to the emergency department for breathing trouble, stomach trouble, whatever it may be, then please go to the emergency department. Do not stay at home. But do not go simply because you're wondering if you have COVID or not. Summary. COVID-19 is a coronavirus, which is a common virus family. It is probably not going away because it lives in the bat population. The COVID-19 is one of the more virulent strains of coronavirus. Outbreaks are going to develop when bats, animals, and people come into close proximity, and no specific treatment exists. All we have is our supportive care. The best defense is physical distancing, and I want to congratulate everyone that's doing that. I want to congratulate all of our leaders for advocating for that. The mayor of our town, for Milton, Alpharetta, Atlanta, thank you all. We also need to be doing hand washing. But also don't forget, we need to seek medical attention. If you're having breathing difficulty or that bell in the back of your head is telling you that something's wrong, please do not stay at home and ignore that. So I want to just close. I'm going to talk and then we're going to take some questions. I think Ed has been writing down a few. And I want to tell you about my first COVID patient. So on March, it was the 14th, it was a Saturday, I took care of a guy, 63 years old, Alpharetta native, had 3 children, had been traveling on the East Coast. He did everything right. So he came back from his trip. He wasn't feeling good. He went to urgent care 2 days before he saw me. He went on a Thursday and was diagnosed with a light pneumonia and put on some antibiotics. Now, he was told about COVID. They knew about COVID was going on and was told to go to the ER if things got worse. So he came to see me on Saturday. I kind of talked to him, of course, and took an x-ray. This is a normal x-ray. Actually, let me turn this around here real quick. This is a normal x-ray over here. His x-ray looks like something, just for protection of him, I didn't put his x-ray up, but this is what his x-ray looked something like over here. His pulse oximetry number was low and he was breathing a little fast. He was breathing his pulse ox was 90%. He was breathing about 24 times a minute. In many places, some places, New York or New Orleans, this patient would be sent home, maybe with oxygen. Here, we're fortunate enough, we haven't not overrun our medical system yet here in Alpharetta, and he was admitted to the hospital. He started feeling better about 3 days in. And actually was they were making discharge plans for the next day. Well, the next day, he started doing worse, and later that night, he started having more trouble breathing and wound up being intubated, putting on one of the ventilators that I talked about. 7 days later, he passed away. And that was my first COVID patient. And that kind of brings together why kind of I'm here and Ed's here, is I just don't want to see that happen to any of us. If you are in your house and you're practicing physical distancing from other people, you're not going to catch this. There's no way you're going to get it. You're not going to spread it to other people. If you have elderly relatives, please don't let them leave the house. You saw Mimi and Pocket. My mother was going to come visit me 2 weeks ago. No way. She's in California. She never got on that plane. So anyway, I'm sorry. I've kind of gone on here for a while. I appreciate everybody's attention. I hope y'all found this helpful, kind of just putting some things together. And I think we have maybe some questions. So feel free to kind of pop up some questions and we'll try and answer them. What do we got, Ed?
I think a lot of people are wondering, are we seeing these patients? And Mike shared his personal story of a patient he saw, but we are seeing the patients, and you can look at the numbers for mortality and things, and it shows how deadly it is in the people over the age of 75 or 80. But a lot of the patients we see that are very sick are not necessarily in that age group. So we're seeing them in all age groups. So not the young, not less than 30, but so that's a little scary for us, and really touches home.
And so one question we had from the cycling group about just riding bikes in close proximity, and you think you might be 6 feet apart from each other, but you think about kind of the slipstreams that we're in and so on, and just as we're breathing hard, and those droplets can just go right into the slipstreams to the person behind you. So I would not recommend certainly riding in any groups, and if you're riding, you just need to be well apart from the person you're riding with. And generally speaking, when people are together, we just start kind of get close, and we just naturally touch each other. We may share a water bottle by accident. I mean, there's just any number of ways that we can be exposing ourselves to other people just when we're in close proximity that they're so second nature, we just don't think about it. I'll be honest, today someone came out to my house to do some work, and I almost shook his hand. And that was because I hadn't met the man before. That's just what we do in the South. That's what we do in the United States. And he corrected, I wouldn't have done it, but anyway, he corrected me. But it's just kind of, if you're just not close to people, it's just not going to happen.
Another concern people have is, how are we prepared in this Alpharetta area north of Atlanta? And I think our ICUs are doing fine right now. Obviously, the question is, the difference between 10 people needing a ventilator and 30 people needing a ventilator is a big deal for our ICUs in a normal hospital up here, and that can just be a percentage point for how many people get sick. So it could change at any time, but we're doing okay right now. Another question people had has been, I know the president spoke about some of the medicines in development, and Mike alluded to this he addressed it in the PowerPoint. But so there's medicines that treat it, and there's medicines that prevent it. And so if we can get a vaccine, that will help a lot. It won't help this go around, but as far as the medicines that treat it, I wouldn't. There's not a lot of hope that that's really going to change a lot. So I don't think for this COVID-19 that medicines are really going to affect. It's not really going to change what's going on.
The biggest thing that'll change, and it's not for this go round, it's for the next go round. It's going to be vaccination, and everyone should be getting a flu shot every year. It's just kind of a no-brainer, because if we have a bad flu, it's just going to it does so. People say, well, it's only 50 to 60% effective. Well, the fact that you've had the shot, even if you were to catch the flu or catch coronavirus, if there's a vaccine for coronavirus, makes it, your body still has some immunity to it. There's still some, even though you caught the illness. And secondly, just the herd immunity, just the fact that we all are protected with a shot makes it far less. You saw that picture of those dots dancing around on the screen earlier. It's kind of like that, is that you have people that can't transmit it because they're immunized. And it just makes such a huge difference. That's what's going to make the big difference. People ask a question about, well, gee, we need to get these testing kits out there right now. And I think there's just a lot of debate on that right now. I think that, and I argued with the doctor about this earlier today, is, the cat's kind of out of the bag already. There's a lot of this illness in the community. I think that testing is helpful from a community standpoint because then when it's in your community, and when you need to start being really careful. But for any one individual patient, we have this argument with flu every year. Is, why do we flu test? It doesn't change what you do. You just tell someone, well, you got the flu, and you let them go home, or you admit them if they have some complication of the flu. But it doesn't really change the treatment in any one individual.
I think that's an important point, that epidemiologically, it's kind of fun to know where everything is and how many cases you have. But for the individual person, if you have fever and a cough, and you have a negative corona test or COVID test, it's not going to change how you should behave one way or another. So,
well, I think it looks like I'll kind of thumb up here. I think we've answered a lot of the questions.
let's see.
Yeah, a lot of folks. Now we're thumbing the screen here. Did we miss one?
Any virus?
Yeah.
No.
Well, I tell you what we'll do here. It's coming up on an hour, or I think we're maybe a little bit over an hour. Is please just message me on Facebook. I'll friend all you guys that listened, and I'll try my best to answer.
What are your
questions
thoughts on food?
Food delivery and takeout. Okay, so that's a great question. People thumbed up that one. Huh. That's interesting. So maybe they can see that. So that's actually a great question, and I think that's just probably depends on your level of comfort with the restaurant that you're frequenting. I will be very honest. I have a couple favorite restaurants, and I'm not going to name them here in downtown Alpharetta, and I absolutely am frequenting them. I know that a lot of private business is hurting right now. When I call them and do the takeout, I ask them, what are you doing to make sure that your employees don't have COVID? And what are you doing to protect the food? And they are telling people that their employees need to be social distancing when they're at home, and when they're at work, they of course they prepare the food. They have to be around other people to do that, but they do not allow anyone to work with fever, cough, and so on. And so the restaurants that I go to have answered that in the affirmative. I would also like to thank the local restaurants, and we are definitely taking mental note of who you are, of supporting the hospital's employees. At our hospital, again, I don't want to, you can probably figure it out, but again, I'm not representing the hospital, so I don't want to name it, but just supporting your local medical folks in the same way. Right now, we all need to support each other. People are losing jobs, people are going out of business, and we need to do what we can to support each other. Again, this is not social distancing. This is physical distancing. We need each other more than ever right now.
So, somebody asked North Fulton versus South Fulton, and we don't have any exact numbers, but I don't think there's any great difference in the number of cases. They have not. South Fulton has not reached out to us to ask for help. Somebody wants to know if you can be reinfected. You shouldn't be reinfected. If you get it, you're immune for that strain, and so that's good to know. And somebody had asked about COPD breathing units.
You must be talking about nebulizers,
or maybe BiPAP or CPAP.
Yeah, so nebulizers are kind of like asthma machines, where you put the medicine in the machine and then it nebulizes, and asthmatics can breathe in this mist. For someone that has COPD or asthma where they're actually having bronchospasm, that is helpful for those patients if they're experiencing that. But this is more fluid in the alveoli. And for patients that don't have asthma or COPD, that we're finding that nebulizers don't help quite as much unless there's a component of bronchospasm. Now, CPAP or BiPAP machines absolutely can be helpful in the home. So if you're having breathing trouble and you have one of those machines, yes, absolutely. But be very clear, if your requirement for your machine is different than what it normally is, you're having much more trouble breathing, do not just turn the machine up. You need to seek medical attention. If something is definitely off for you, you need to make sure that you're not developing something that needs a higher level of care. Are obesity and smoking factors in death? Smoking, yes. There is thought, and why that is not entirely clear. They think that, there's probably just some underlying lung damage, and when you have a lung disease, smoking can make that worse. But also there's something about those receptors where the viral particles attach, they're upregulated. There's more of those attachments in people that are smoking. Obesity, I'm not sure that that's related.
Right. I mean, you could make a statement that if you are a healthier person in general, when you get a respiratory type illness, that a healthier person is going to have a better chance, whether it's but you really need to do big studies to really know and compare.
Yeah, good question. I'm still unclear why the patient died.
So
Why the patient died was sent home was a treatment plan. So maybe I wasn't clear about that.
Yeah.
So the patient, he went to an urgent care a couple days before he saw me, and then he was sent home because he was, he just needed antibiotics. A lot of people just get antibiotics and go home from the urgent care. But when he saw me, I didn't send him home. He was hospitalized at that point. And after 3 days, this is what we see with COVID is people seem to be maybe doing a little bit better, and then they can worsen. And that's what happened to him. He never left the hospital.
So, and people have asked, when is the peak going to reach in Georgia? And we're not epidemiologists, but from what we've read, it seems like the next 3 weeks. I think, what were they saying? Like the April 22nd, I think is one day. So in that general area.
Yeah, we think we're going to certainly know a lot more in the next month. And then the question is, well, all these people are staying at home, and so 80% of the people were never exposed to it. So what happens when we all come out of our holes? Are we all going to then get exposed? And I think we're going to have some clarity on how that process should happen, because the obvious thing is, well, okay, all it takes is one person from the outside to come in and just infect us, and it all happens all over again. So I think we're going to need very clear direction. I don't think there's just going to be a day where we come out and it's business as usual.
But I do think that particular strain will run its course, and because whether it's seasonal.
Somebody answer that question. Should we go on group rides or not? I think that someone's hopefully just sending me a softball and not answering that question for real. The answer is absolutely not. Please no. Someone's asking about specific hospitals, and I want to stay away from preparation at any specific hospital, but maybe we can talk in general.
In general, I think our hospitals in the at least North Atlanta area are not maxed out. The problem is we haven't hit the maximum. We're still on the upward part of the curve, so we don't know when we're going to peak. So, but yes, we are not maxed out right now. But there, it's real. It's there. The patients are there. It's filling up.
We're very fortunate to have the experiences of other large cities, and the fact we're not a city that has a lot of the Verizon Amphitheater hasn't gotten started yet. So we don't have, the New York situation or the Mardi Gras situation here. And so things have happened later here, and we can learn from other cities. And hopefully we have our physical distancing in place early enough. And it's been now, a week and a half, 2 weeks. So, that's good. I mean, people that have it, should be declaring themselves. So, we're just cross our fingers here in the North Atlanta area anyway.
So somebody asked if an infant can spread it. An infant can spread it just like an adult. So yes. And
they have a lot of secretions and all of that. So yes, absolutely. Kids, though, fortunately tend to do much, much better than adults. Now, there are young people that have had this, but young people tend to do much better with this particular virus relative to others. What about UPS packages? Should we spray them down? I don't know if I don't believe anyone's necessarily done a study on, how much virus there are in different packages and so on. We do know that the virus can live on surfaces such as cardboard up to 3 or 4 days. So it is what I personally do is I open the package and then I just wash my hands. So I pretend like there's virus all over the package. We've seen these shows, where they have the blood spattering. They bring the luminol out and they put luminol all over the wall. You need to think that that's coronavirus. That there is coronavirus all over this package. So when you're opening it, you touch it with your hands only. You open the package, you get the package out in the trash, and you wash your hands, and do not get your hands near your face. Because that's what happens. Hands touch something, we all touch our face. We scratch our nose, we wipe our, do our hair, that's just what we do. So we just need to wash our hands before we touch our face. with anything like that.
So it's 8:00. I don't know if.
All right. So Ed's pointing out that it's 8:00. It's been about an hour. Thank you all.
One last thing. Somebody had asked if they could watch
You're the
this
one that
from
said
the
it was
beginning.
8:00.
But if somebody had wanted to watch it from the beginning, is there a way for them to? Is this?
I think what I'm going to do is I'm going to record this, and you'll be able to get it on my Facebook page. If anyone has trouble, just email me, send me a Facebook message, and I'll try and figure out. I'm not really good with Facebook. I had some IT support before this. Thanks, Mike Moss, for that. But I will try to do that. And if anyone has trouble, just let me know. But I will try my best to make sure this is recorded. Thanks, everyone, for great questions, and hopefully this was educational for everybody. Thanks.